for me to introduce our seminar speaker today. I'm not going to steal this thunder. Can you hear me, Jenny? Can you hear it now? Okay. It's a little bit fickle today. So it's a pleasure to introduce our speaker today. And the reason why it's actually a special honor for me, because your speaker today just happens to be somebody that was with ASU how many years ago? 45 years ago. And interesting enough, our speaker, Bill Cologne, and I have a special relationship because we were a student teacher at one time. And so, but the real important thing is that he was here at the ground floor of where our program came from, biomedical engineering. It actually started out in chemical engineering. Bill left at about the time we got the Board of Regents approval for creating our own program in biomedical engineering. And so there's no question that, you notice students that come through programs. Well, Bill was one of the best and brightest in chemical engineering, but he didn't have aspirations to go to graduate school. He wanted to get out there and do business, and he wanted to move the med tech space. And so the first job he got was with a startup company that sort of spun out of a bunch of places, but ASU was directly involved. And they developed a small technology or a new technology with a very small company. How many people you started off with? 25, and you grew it to about 200. About 250, so I won't steal too much, but in any event, that technology became one of the premier technologies in the cardiovascular space. I'll let Bill tell you about it. But interesting enough, that technology was bought up by C.R. Bard, and now it's BD, and that space of that technology in BD is now run by one of our graduates from biomedical engineering, Stephanie Clokey. That probably doesn't know Bill, but it's funny how this thing went full circle. But he's going to tell you a really interesting story of how you can get into the startup space. And he's an inventor, he's an entrepreneur, he's done a lot of deals, he understands what it takes to get technology into the practice, the healthcare system. So I'm going to let him take off with his confessions of a serial entrepreneur. Bill?
Thank you, Vince. And if anybody can't hear me, let me know and I'll speak up a little bit. So it was I think last fall that Katie reached out to me and said, do you want to come over and do this? And I immediately said yes. And then when she invited me, I thought, all right, now what do I say? What do I say to you folks so you'll learn something or you think it's interesting? And I asked Katie, I said, well, what am I supposed to talk about? She said, anything you want. So I made it pretty wide open and I thought, man, what can I do that'll be a little bit different than what you're typically used to seeing. So I wanted to start with just storytelling of where I started and what I've done and where I am now. So the first thing that's most important, and it's already not working. Do I need to be over there? Oh, okay. Is this. So this is a picture of my left ankle. So you know that I'm one of you through and through and dedicated. And I can't believe how much conversation this has started because I live in California, so I'm wearing shorts a lot. So anybody who's gone to ASU always comes up and talks to me when they see this. But then of course I get the opposite too. I get the Tucson folks will come and talk to me. And my wife and I just moved into a new house a year and a half ago. And the guy who lives right next door was a baseball player at U of A. So we met him in the summer. This was the very first thing he saw. But this has been a great conversation starter. And I did this, I think, 12 years ago on vacation in Hawaii. But going back further, has been talked about, this is my student ID from August of 1976. So I just driven out here from New York. I couldn't believe how hot it was. And so that's why the hair is a little crazy. But so August of 1976, I was sitting up there where you guys are sitting now. So it took me 5 years to get through school with a degree in chemical engineering because I was playing baseball the first 3 years. So I took kind of lighter loads and the program was pretty tough. So graduated in '81 and first job out of college, as Vin referenced a little bit, was for a company here in Tempe called Impro. So it was a small startup company that had about 20 employees and sales were about $1 million a year, but it was perfect timing for me to get into industry. I only got hired because the president of the company and the hiring manager also both had engineering degrees from ASU. So I think they are partial towards me. So I got the job. So the main product in that company were surgical vascular grafts. So all those are extruded Teflon tubes or PTFE tubes. And I was extremely fortunate when I started. They had such small output because the sales weren't very big, but their facility had 2 clean rooms and 2 sets of everything, all the equipment. So probably the first year I was there, all I did literally every day was go in and run experiments. So I practiced at doing all the processing without anyone else's help from the very first stage through the final stages. So I became an expert, more so than they had ever had, at making these surgical vascular grafts. And through that research and through that testing, we made some pretty severe product improvements. And like I said, we had sales of $1 million the first year. Every year the sales were doubling. So year 2, it was 2 million. Year after that, it was 4 million. Year after that, it was 8 million. And when I left the company 11 years later, we had 250 employees and sales of over $40 million a year. And over half of the employees worked for me. I was a director of operations. So I did all the IP filings. All the manufacturing people worked for me. All the engineering people worked for me. And engineering was 2 components. There was design engineering, which did all the equipment and kind of R&D work, and manufacturing engineering. So I learned a ton, and this was probably, so fortunate that I got in early in a small company that had the capacity to grow, and they just let me run. They gave me leeway to do whatever I wanted to do. So the most important professional lessons came from this company. One of my first bosses was the smartest guy I ever met. He had a PhD from MIT in mechanical engineering, and he was always really good at taking very complex things and simply explaining them so people could get them. But I remember the very first conversation I had with him when I started, he said, when you start your job, the best thing you can do for yourself is network and develop relationships. And he constantly was on me about that. So he said, so when we go to meetings or when you meet physicians or anything professionally, introduce yourself, go to every event, show up early, stay late, go to the after dinners, go to the after happy hours or parties, go to any presentations. He just really, really stressed, and at the time it was Rolodexes, we didn't have LinkedIn, but very, very quickly, I successfully built a huge Rolodex, and it was a physical Rolodex. I had those round things and they would fill and I'd get a second one, and I ended up having 4 of those. But I worked really hard at not only meeting people, but developing relationships with those people, and not only reaching out to ask for help, but also reaching out to give help. And that has served me well. And you'll see later on how that has come back to help me. The only thing that was extremely valuable and carries value today is make sure you become an expert at something. So I talked about the PTFE processing expertise, and I was so into that. And for over 20 years, that's what I did, and that's what I focused on. And now I've become a well sought after expert for PTFE consulting. So I've consulted for companies such as Medtronic for PTFE projects. I'm doing multiple projects for a very large company in China right now because they found me because of my PTFE experience. So a lot of the medical devices have PTFE components, and frequently they reach out to me to help them design and develop new devices. So on the opposite side though, one thing I didn't learn was patience. So when my wife is here and she'll tell you, I still haven't made too much progress in this area. But I remember every year for at least the first 5 years in my reviews, they wrote almost the same thing. I didn't work well with others. I was too impatient. I didn't tolerate people that weren't as smart as me or wanted to work as hard as me, or people who could go at the same pace as I. And that did hold me back a little bit. It was something I had to develop down the road, but I got the message, and I think I improved, but I think I'm just generally that way, overall personality, but it was communicated to me loud and clear. It came into play a little bit later when I started working for larger companies where you had to work with bigger teams. And you had people with varying backgrounds, different degrees of capabilities. And I really needed to learn to tone it down. Because in the early days at Impra, I just bowled everybody over, took over everything, ran the projects myself. But as I got into larger organizations, that didn't work anymore. So worked at Impra for 11 and a half years. And because of the networking that I did, the last couple of years, I got called quite a bit, either from recruiters or from clinicians I had worked with, wanting me to go and do startup companies. So EndoMed is a pretty interesting story. There's a very famous vascular surgeon in the Bay Area named Tom Fogarty, who invented the Fogarty catheter. He wanted me to move to the Bay Area. I was living here in Tempe to do a startup with him for a very brand new technology. And I didn't want to move to the Bay Area. I had a daughter who was 1 year old, very expensive in the Bay Area. And I thought, yeah, it's going to be too tough of a transfer. So Dr. Fogarty said, hey, there's another guy in Phoenix that you know, Ted Dietrich, who works at the Arizona Heart Institute. And I'll get Ted to join the company and you can do the work in Phoenix, but still be part of the company. So I went to meet with Dr. Dietrich and he said, you know, let's forget Tom Fogarty. I have my own ideas. Let's do a startup together. So I remember it was probably midweek. I got a call from Ted Dietrich's secretary and she said, hey, can you come on Sunday? Dr. Dietrich and a lawyer and a business partner want to meet with you. So I showed up on Sunday and he always liked to do meetings outdoors. He liked to work on his tan. I remember I had a dress shirt and I was sweating and stuff. And so they put on the table in front of me an operating agreement and a shareholder agreement to hire me as the VP of R&D for a new startup company called EndoMed. So I'd worked at Impra for 11 and a half years. I was the number 2 person in the company. So I went home that Sunday night, thought about it, and the next day I went in and quit my job. So I just knew that I felt like I had to try something different and I had to try something where I had even a bigger role. So EndoMed was a fantastic experience. I learned a ton more. And the main product that we ended up developing before the company sold was endovascular grafts, which was very new. This stuff all came about in the early 1990s and became clinical products in the mid 1990s, the first use in man. So these devices are used to treat abdominal aortic aneurysms non-surgically. Before they had to cut you open, expose the aorta, and fix the aneurysm. Now with the catheter delivery system, we were putting these things in through your groin, deploying them in your aorta to rebuild your aorta. And the interesting thing about this technology, Dr. Dietrich had told me for like 2 years, we did some early stuff that we licensed, made a lot of money, but he wanted this new device and I could never figure out how to make it. It was pretty tough technically. And one morning in a really, really, really long shower, it hit me. One simple thing hit me that I needed to do so we could make these. So this resulted in a whole new product line that we ended up manufacturing ourselves. We built a new facility, we built a clean room, we hired a handful of people, and we did all the testing and got these through the CE mark process. So we had approval to sell these in Europe, I think starting in 2001. So one thing that was different than what was on the market from the bigger companies, we could make custom devices that would fit anyone's anatomy. So we had the ability to get a CT scan or an angiogram, and we could look at the aortic dimensions, and we could make a perfectly matching device to fit that patient. The other companies could do that as well, but it would take them 4 to 6 weeks. We could ship our devices in 48 hours. So right away, we had a big uptake in Europe. But we had one problem. No one had ever heard of us. We were a company of 14 people, 0 sales to start. Our competitors were W.L. Gore and Medtronic and Cook, all multi-billion-dollar companies. So we said, okay, here's a time where we have to take a risk. So the risk was this. So this was our first advertisement that we put into Journal of Vascular Surgery, all sorts of medical journals, which I hired a really edgy advertising firm here in Phoenix, tried to explain, look, we can't do the same old stodgy advertisement that you see in these journals where there's data or there's boring pictures or pictures of physicians and their white coats. We need to make a mark for ourselves. So when this advertisement came out, all the journals that had this ad said this was the most recognized and the most talked about advertisement they had ever placed. Then on the other side, I had a bunch of friends call me and said, we see that you posed for your new advertising picture. And it was interesting the way this was received in Europe. We were only selling in Western Europe. The Nordic countries hated this. Our distributor said, this is too bold and too out there. Our doctors don't like this. But then when you went south to like Spain and Italy and Greece, they loved this. So it was really interesting to see. But this was a very popular ad that ran for a long time that put us on the map. People found us and we started some initial sales, and for 3 consecutive years, we doubled sales, or actually 4 years, until we eventually sold. So with this company, some new learnings, had to be willing to take risks. I mean, I thought about it for one night, quit a job that I had for 11 and a half years. So that was a big risk. The advertising piece was kind of a big risk. I remember showing it to the physicians in our company, and I didn't think they'd go for it. I thought they would be conservative, but we recognized we needed to make a splash. So, you know, if we want to make progress, we had to take a risk. So some very important lessons from there. But other important lessons came from there. If you're going to do this, for those of you who are thinking about becoming entrepreneurs, plan financially. I know a few times there were things I wanted to do, but I wasn't financially prepared to do them. Generally, startups are much more risky. They can end with moments notice. They generally will pay you less out of the gate. The automatic bonuses that you get every year from the well-established companies, you don't get those. So you have to make sure you've got a runway, not only to be able to maybe take a bigger opportunity, but with a little less pay, but also be prepared if something happens and this shuts down, that you're not caught off guard. And then this was one I fell for too. You know, I tended to be very optimistic that regardless of the problem, I would always figure out a solution. I always thought I was clever enough. I always thought everything would work out. And it seemed the first 20 years I did this, it seemed like that always happened. But this came back to bite me at a big time with EndoMed. At the tail end, when we knew we wanted to sell, we had a really big deal on the table from a large company in China who wanted to buy the company. They gave us their earnest deposit. They did all their due diligence. And literally like 2 days before the deal was going to close, they just turned around and backed out and said no. Well, unfortunately, we had run the business like, this is the end. We know we're at the tail end. We're going to sell. Everything is going to be great. So it left us kind of cash strapped in the business. So we had another year of really struggling and really, struggling to hold it together and staying in business. We eventually did get another sale, but it was for significantly less. So the lesson learned from that, even though we had the deal until it was completed, I should have run things like the deal wasn't there. So in 2005, EndoMed sold to LeMaitre Vascular. And this was about a 1.5 year period I had to work for them, and I hated it. I hated having a boss. I hated to have to work for another company. So I stayed just that 1.5 years. LeMaitre Vascular is in Boston. We were in Phoenix. So our Phoenix lease ran out in 2007. They moved everything to Boston and said, you have to come and move here now. And I just said, no, there's no way I'm moving from Phoenix to Boston. So I quit, and then I just did consulting. I had built enough of a network and I knew enough people where clinicians were reaching out to me with new product ideas. Companies were reaching out to me for consulting. So that's what I did for about a 4-year period. This is just one example. I think in that time period, there were 3 products that I developed that were physician ideas that I then licensed to other companies in cash deals. So this one, this unballooned, this was named. I also sold this to LeMaitre. Interestingly enough, they bought the company and they bought the first product I developed afterwards. This was used in endovascular aneurysm repair. This was a way to remodel vessels without creating pressure gradients across the vessel. So this was pretty successful as well. So 2011 is when I was able to get over to California. This all came about because of connections again. I was consulting for a company in Palo Alto called Nellix, and simultaneously consulting for a company in Irvine, California called Endologix. I knew both CEOs really well. I'd actually gone to college with the Endologix CEO and worked together with him for a while. And I knew the nellix CEO because he had done due diligence on EndoMed and almost bought the company when he was working for another firm. So I saw, I believe it was in October of 2010, I saw a press release, Endologix acquires nellix, and I was consulting for both. Sent an email to both CEOs saying, this is great. I think you guys will do wonderful together. And about 30 days later, the CEO of Endologix calls me and said, well, obviously we want you to come and put this together. So we need you to leave Arizona. We want you to go to Palo Alto where nellix is. We're going to give you 6 months to close everything down up there, bring it to Irvine, California, and finish development. The product they wanted me to work on was an early stage development. Since I was consulting, I knew a lot about it, but it needed a lot of work. So January 1st, 2011, so New Year's Day, I got on a flight from LAX. I had to fly to Riga, Latvia to watch, I think I saw 4 or 5 procedures in a 3-day period there for the device they were developing. And then they turned it over to me. I came back to Palo Alto, and about a month later, I came to Irvine for kind of the first management review. They said, this thing, we told you had 6 months to bring everything down here. We want it done in 3 months. So I still remember March 27th, 2011, 87 days after I started, we moved everything from Palo Alto to Irvine. So this product nellix was incredibly new technology, a new way to fix abdominal aortic aneurysms, really clever technology that I thought was fantastic. And just from my experience, because it was PTFE based, it was surgery where I'd been in several hundred of these procedures, and they gave me a pretty sharp team, but I mostly was the liaison between the clinical folks and the R&D team. So we developed this new device and the procedure to put this in because it was quite different than what was currently on the market. So the nice thing about this, I did probably the first 200 procedures for this. I went into the OR, I trained the clinicians how to do the procedure. I read the CT scans to size the device. I taught our clinical specialists. And I think it took us 2 years and 2 months from the date I started for us to get regulatory approval to sell this in Europe. Second year of sales in Europe for this were $30 million. Stock of the company, I think Endologix had a market cap of about $300 million when I started. By 2013, 2014, the company was worth over $1.2 billion because of how well this went. But good things don't last forever. Oh, no, it's not. Sorry. So the company was making a lot of management changes. Some of the really good people were leaving. I had done what I set out to do. I didn't really have anything exciting for me thereafter. And because of connections again, another opportunity came to me. One of the board members on Endologix was the CEO of a new startup company called Direct Flow Medical in Santa Rosa, California. And he saw the development I did with nellix, and he had a company that developed transcatheter heart valves. And this is a very different product. Again, but it had some similar features that the nellix device had. It didn't have any PTFE in it, but it used polymer. It was a different way to do transcatheter aortic valve replacement. And they wanted an improved delivery system and an improved product. So I went to Santa Rosa, the interview, I knew they were going to hire me. It was just to check a box. And when I got there, I just asked a lot of questions, but specifically they told me, we just got new financing. We've recapitalized the company. We have a valve company in Lake Forest, California, where we have an office, but most weeks we want you to come to Santa Rosa. So for 4 months, every Monday I flew to Santa Rosa, and every Friday I flew back down to Irvine. But the very first week I was there, we did an executive team meeting every Monday. They said, well, the money we told you we were getting, we don't have that money yet. I go, what do you mean? You said you recapitalized the company. Well, we have a term sheet, but we don't have the money yet. So every week for 4 months, we would hear the little progress we were making for collecting this $65 million they were raising. So then in about 3 months after I started, they said, hooray, the term sheet's been signed. we're getting the money in 30 days. Everybody can relax. Let's get to work. So a month later, I was traveling in the East Coast. I went to visit a clinical trial site. Then I went to Miami with my wife on a vacation. And when I was there, I got an emergency meeting announcement, which I knew couldn't be good. So we had a Thursday night call, get on the call, it's the executive team, and they say, the funding fell through, the company's closing tomorrow. And beyond that, we have $0 left. So any vacation pay you have or any PTO, you get nothing. So all 150 employees in 3 locations, 2 in the US and 2 in the US, 1 in Europe, you guys are out of a job tomorrow with no more pay. So I'm glad I prepared. So this is what I learned before. The startups are risky. Sometimes they go great, but with 1 day notice, this place closed. So I come back and for a couple of years, I'm doing some consulting and go to work for another heart valve company, but on a contract basis, because I'm not sure I want to be in that market. I believe that all the new technology is out there and I didn't really see any room for another startup. One night I get a text from a guy that used to work for me. I hired him out of college to work for me at Impra. I hired him in 1992. We stayed in touch. He became a serial entrepreneur, did 3 startups in the neurovascular space, sold them all. And he sent me a text with a picture of my office nameplate from my office in the Lake Forest building, which we just closed. I said, how did you get that? He goes, well, we're going to rent this building. We should go to happy hour. So I go and meet with him and he tells me he's advising a new startup company that raised a little bit of money, but they're really struggling. And I would be a great CEO for that startup company. So he introduces me to the CEO and they want to hire me as the CEO for this new startup company. And I'm starting to get a lot of calls from some board advisors they have. And so this company, Spinal Singularity, now is way away from what I'm used to doing. So this is a urology product. The company founder was a Marine commander who was shot by a sniper in Afghanistan. So he was paralyzed from the mid chest down. So now he does not have bladder function. So he has to use intermittent catheters. He has to catheterize himself 5 or 6 times a day with disposable catheters. So he wanted to start a company that made products to help people with spinal cord injury. And the first product that he developed was this connected catheter. So mainly for him. So he wanted to do a catheter that you could insert into the male urethra. It'd go from the bladder midway through your urethra. And then it had a valve. And on the far left there, there's a valve you can't see very clearly in there that you could open and close with a handheld controller. So you would insert this catheter and leave it for a week at a time and then change it. So one of these catheters would essentially replace 50 intermittent catheters. Pretty clever. I had some concerns. I had some concerns about, all right, nobody's done this before. I don't know anything about this anatomy because you have patients who are ambulatory or non-ambulatory. They have sensation, they don't have sensation. Urethra diameters and lengths are different. Bladder sizes are different. Prostate interference is different. So I said, all right, we'll figure that out though. So, and then I also have this board advisor who's calling me daily saying, Bill, you've got to do this job. You have to come and do this. Our investment firm will put $1 million into this. I know another guy who put $2 million. You've got to come and do this. So I take the job. And so then the guy who's calling me all the time, his firm does put in $1 million, but the other company tells me it's going to put in $2 million doesn't. So I have to go through a lot of fundraising. We ended up raising $6.5 million for this company. And then we got another $5.1 million in government grants. So we're off and running. I had to kind of redo the staff, hired people that I knew and made a lot of progress. But 3 different times we went into the clinic and the device didn't work properly. And all the things I worried about came into play. First device we made migrated out of the patient. So we made a device change. Second device we made migrated into the patient. So we made a change. Third device we made stayed put, but it was too uncomfortable for the patients to keep in even for a full day. So we were struggling. So in the meantime, the board guy that was always calling me and really working with me, who turned out to be a handful, he started a little bit of an emailing campaign with the other board members and some shareholders saying, I don't think Bill is doing a good job. And so there was this undertow. I was made aware of it, but it resulted in me just getting a phone call from the rest of the board saying, we're going to change leadership. You're out of here. So only time I've been fired in 40 years of doing this. But you know, something I was okay with it because I kind of realized it was a difficult problem. I probably wasn't an expert in the space, but also 2.5 years later, these guys are further behind them when I left them. So I still hope they make it because I invested in the company as well, but learned a lot of lessons there. So after that happened, the guy who set me up with them, the guy I originally hired out of college in 1992, he said, you know, we get so much deal flow from our connections. Let's put together a venture fund and fund our own ideas. So we started that in January of 2020. 3 months later, the pandemic hits. So we are not successful in raising any money because we can't visit anyone. Nobody can visit our facility. We can't build relationships. You know, we had probably looked at 200 or so different technologies and picked 5 we really thought were viable. And we couldn't collect the funding. So in January of 2011, or excuse me, 2021, we said, we have to do what we've always done. Individually, let's just go raise money for these companies. So the first one on the books was Single Pass. And again, this came from a connection. A physician that I developed a product for in Phoenix, we sold it to Stryker. He made a lot of money. He was then referring his physician friends to me anytime they had ideas. So we had 2 interventional radiologists here in Phoenix that invented a pretty cool device, an electrocautery device to be used during deep tissue biopsy procedures. So there's a lot of bleeding in those procedures, and right now they don't do anything except for pull the needle out of your body and put pressure on and hope you don't bleed. So these doctors said, you know, if we could cauterize that tissue tract and just stop the bleeding, this would really improve clinical outcomes. So these doctors came to us, they already had a working prototype and 1 issued patent. So in May of last year, we raised $1.5 million. I became the company CEO. We had the doctors co-found the company with us. So now we're quite a ways down the path with this company. We're at design freeze. We've done 2 animal studies. And the end of this month or early next month, we'll treat the first patients with this device. So what did I learn from all this that happened? So this is covering 40 years now. This was the most important thing. And this was a cut and paste. I think I had this on my computer desktop for the last 15 years. This really, really simple thing. And it seems so intuitive, but if I listen to people when I'm meeting with groups or even in personal introductions or one-on-one introductions, all of this is incredibly important to develop solid relationships. When you're in there meeting with people, so they know you care about them and you have interest in them, just this really simple list that even if you Google this, it'll pop up on the internet. And you'd be surprised how many people don't do these simple things. But these simple things led to every opportunity that I've ever had. Other than the first job, I never truly had to interview ever again for anything else. People always sought me out. And it was because I really listened to boss number 1, who said, build network, develop the network, practice working at the network, give back to the network, and this will take care of you. So part of what I learned through this, you know, do you have what it takes to be an entrepreneur? I don't even know what the 5 characteristics are. I just found that picture, but if you're willing to take risks, you know, and you prepare for this, you know, and you have that mindset where you'd rather work for yourself than working for a company, this is something you should consider. So I'm going to finish where I started. So this is more body art I have on this arm, and I don't know who can read Latin, but so this is what I'm all about. So I think it was about 35 minutes, so I'm ready for questions. So is there a mic to hand out, or are you just gonna? Okay, sure.
It seems now you're kind of into multiple technologies, but you've also started to stay with the, you know, the cardio space for a while. And then you decided to make that change over to try the catheter. Is there a reason specifically that you decided to do that? Like, how did you decide, no, I'm going to move away from my kind of specialty and try something new just because of people.
You know, I think it was a compelling story that, so the Marine veteran who started that company is a very outgoing guy and very, I mean, when you see him and hear the story of how everything happened, it was just a very compelling story. And the only thing I knew with my background and with his story, we could raise money at the drop of a hat. So again, but what I thought about was worrisome. I'm like, okay, I don't know any urologists. I don't know that anatomy. So that was a little bit of a risk. And yeah, maybe I could have figured it out, and maybe they still will figure it out. But the group I work with now, we always constantly are saying when new ideas are presented to us, we should stay in our lane. We should probably stick where we have expertise. That's one whole question.
So, first, what made you take that first lead? This was your first startup, building up and everything.
I think I had the feeling that if I analyzed it and thought about it a lot, I would never leave because I was so well compensated and it was very safe. And, you know, being the number 2 person in a company, I thought if I don't do this, I was 35 years old at that time. If I don't do it now, I won't ever do it. And also, you know, my salary was dictated to me. My bonuses were dictated to me. You know, I wanted to get away from that. I wanted a chance, you know, I never was ever going to make anything big. So I wanted a chance for bigger upsides, for exits, for deals. And I liked the deal making. You know, I think I've sold one company, I've sold 4 or 5 technologies. I like that aspect of it. I like the business aspect of it. So I'm glad I did. I think within the very first day when I went to work, when I came home, I remember thinking, oh my God, I wish I had done this earlier. No, so the new startup company, EndoMed, I was the only employee for 7 years. So when we started hiring people, I told them I was employee of the month for 84 straight months. So, but it was just, I knew I connected to a really famous physician who had deep pockets, so we had funding, and he was on the forefront, and we could meet with any of the companies because of him. And also the other thing, since he was at the Arizona Heart Institute, I would just go watch surgery 5 days a week. So I became super experienced in the OR. And so that really, really helped me. And I didn't think I could get that anywhere else. So, oh, yes. In the relationship. So when you're speaking to somebody.
For the members who are on Zoom, if you could repeat a synopsis of the question, just so that.
Oh, okay. So when it's, we don't multitask, doesn't mean don't do multiple projects, but this was for networking and relationship building and in meetings. So if you're talking to somebody and they're looking on their phone, or, you know, or if you're in a group and you're listening to something important, but you look and people are checking email and stuff. So it's mainly that. And there's a lot of data out there that multitasking doesn't work. Your brain can't focus on 2 things at the same time. And people will say, well, they're not interested. They're disinterested. How am I going to develop a relationship? I'm talking to this person and they're checking out their phone. Yeah. Okay, so what do we look for when we evaluate ideas? So it's always the same thing for us. So first, it needs to be, you know, a large market that's there for sure. We don't want to create any market with an unmet need where the proposed solution is viable, that we can get IP protection. And now I do have a lot of people that invest with us to say, we don't even care about the technology. We're just investing in the team because you guys have been successful. But when we look at deals, we want to see, you know, we need to see markets that are $500 million a year or larger, typically like billion-dollar markets that are growing, where there's no other solution. Then all the other parts, it trickles down to Can we get freedom to operate because there's no other IP blocking us? Can we have our own IP? Can we technically achieve a solution that's affordable? You know, if it takes you $1,000 to build something that you can only sell for $500, of course, that won't work. And since we do med devices, we have to make sure it's reimbursable, that there's a way for the healthcare system to pay for it. So for us, because we're med device, it's always that. So our deal flow, doctors call us all the time. All the ideas we do, doctors call us, and typically they'll either have an idea in their head. A lot of times they've filed patents. Occasionally they have patents issued, and we do the same analysis. And then for us, usually though, we want to have expertise in that area as well. Yes. Okay, so how would you go about generating expertise at your first job? You know, and I think mine happened to be technical expertise, but now the network of people I work with, some of them are clinical experts, regulatory experts. And I think you have to look for where the opportunity is for where you are working. And just, well, I think first your level of interest, you know, where do you have some talent? Where do you have some interest? And then just dive in. I don't think anybody will ever hold you back from wanting to become the expert. And in some of the companies, I even think at Endologix, since that was a large company, we had at one point almost 1,000 employees. I saw some people weasel into areas where they didn't initially start, but they wanted to learn, they wanted to develop expertise. So generally, I think you can move around and you can pry your way in if you're determined. Yes.
You mentioned you sold one company, sold, when you're selling a technology, how do you gain traction without necessarily having sales or things like that? Get sales and stuff. Or build a shell company and then sell the technology. How do you go about selling?
So how do we go about selling the technology? Well, EndoMed's case, we had revenue. So that was a simple one. The other ones were just compelling enough solutions. So the other technology we sold, literally, we filed IP, we made working prototypes. We sometimes would even do animal work or just even sim use work, and that was enough. Now, those didn't turn out to be as big a bucks as when we sold technology or sold the company, but still, even without revenue, we were able to generate value. Again, IP is very, very important for the most part. And then I think too, when you know the companies will clearly understand, is this going to solve an unmet need? And then they look, if it's a relatively simple regulatory path for them, they'll take it. But nowadays, everything we try to do, we try to finish with regulatory approval. We won't try to sell anything until we have regulatory approval and have an initial commercial launch, so there's some revenue. And others? Oh, one more.
In regards to like regulatory, is there certain paths you typically try to avoid or certain paths you are more keen to get involved with? And you just have to do it.
Okay, so yeah, do we avoid anything for regulatory? So it's interesting, 10 years ago, investors didn't like class 3 devices because they took a very long time for a turnaround because of the approval process. Now, the investors are telling us they like class 3 devices because the barrier to entry is bigger. So, but right now we have 3 startups going in parallel right now. Single Pass is a class 2 device, and the other 2 companies have all class 3 devices. So we do a combination. And there was one more, yes. How do we decide when to sell the startup company? 2 things: when you have to because you're running out of money, or when the check is finally big enough. So there's a lot of factors as to, you know, are we going to need more cash to keep it growing? And we sold EndoMed because we were growing so fast, we couldn't cash flow the growth because you buy things early, you manufacture a month or 2 later, you sell, and you're not collecting the money from distributors or hospitals for 3 or 4 months thereafter. So the cash required to purchase things is due 6 or 8 months before you're collecting the money. So that's okay with slow growth or no growth. But with rapid growth, it's really hard to finance that. So we sold because it was getting tough from a cash flow stance. But you'll know, I mean, and it isn't a single decision by me. It's myself and our board members will decide, hey, is this an offer we're going to accept? Yes. So you're asking if we've ever been able not to produce enough to meet demand? Yeah, I don't think we've ever run into that. I mean, I think a lot of it, so what you typically do for the startups is limited market releases to see how it goes, because you want that first data set to be good. And you also want to do controlled growth, because you don't want to run into that product. If you do just, we're launching in every region overnight with everywhere, you'll create a problem. You don't want to do a back order problem. So we would do controlled launches or what we call limited market releases. I know we're at the time, and I appreciate everyone coming on a Friday right before. What are you planning?
Hey, Bill, can you hear me?
Oh, someone on Zoom. Yes.
Yeah.
That scared me. I didn't know where it was coming from.
Hi, Bill. This is Tilak Jain.
One of my people that I help mentor. Sheila.
Yes, and thank you so much. And I just want to say, you've been a mentor for me for 18 years. I started off at Arizona State University as well, biomedical engineering. I'm truly humbled by what you showed today. I'm actually really surprised that every time I called you, you were always like literally, within the hour, you responded and you helped me out several times over the last few decades. So thank you for that. I did have two questions for you, and maybe this will be helpful for the group here. The first question is, what were the challenges on your personal front? I know your wife's in the audience, and maybe this is a question for her, is what were her challenges, as you were doing the entrepreneurship route, and how did you manage and balance all of that? And what did you have to do in your relationship to make sure everything worked? And then the second question is more on the professional how did you select people to found companies with? What were you looking for? What are the kind of ethics and morals and things that you look for in a partner?
Okay. Question number, honey, do you want to answer that? No. So. No, I mean, it is stressful in relationships, and Maria is not my first wife. So I never stop working. So right now, because I'm dealing with China and with Asia and with Europe and with all across the US, I work as much as I choose to work. So the phone and the email is always going to go off, and I just have to pick times. Usually till 8 or 9 p.m. every night of the week, I'll just say, I hear things are pinging in. I'm not going to answer them. And as I was doing the tours today, things were pinging in all day long, and I have to pick a time where I'm going to stop. And I try to pick one weekend day where I stop and don't do anything. Sometimes it's hard because I have so much going on. So right now I have 2 companies and 3 consulting projects. So but I just feel like I just had to pick time. And it is stressful in relationships. Although I did have the freedom when my daughter was growing up, I don't think I ever missed any school functions. She was a swimmer. I never missed any swim meets. So I had freedom to do that because I was an entrepreneur. And the second question, as far as who do I pick, I think it was like-minded people. And everyone that I ended up working with were people that I developed a relationship with. I mean, for the most part, they sought me, say, hey, we're doing this new thing. Can you come and help us? Because we know you and we like you and we believe in your expertise. And then very rarely am I going to somebody new that I haven't dealt with before to roll into one of the deals that we're doing. So it's just, that network, that his name is Mike McClurkin, Dr. McClurkin, who told me to do that, made my career, because my network is gigantic, and it really paid off. Everything that I've done after the first job came because of that network.
Thank you, Bill.
Thanks, Elok. Good luck.
So we're at the end of official seminar, so let's give Bill another round. of applause.
Thank you very much.